How does the Eversense 365 CGM sensor work for patients in real life? We're sharing 3 of our patients' real stories and CGM downloads from a snorkeler,
a rock climber,
and a cyclist
to show how the sensor adapts to each of their unique needs. Now, you guys can stop now.
Sorry.
My bad.
Yeah, well, so the Eversense 365 continuous glucose monitor system is implanted and worn under the skin, and it sends glucose readings via a transmitter worn outside of the skin to a smartphone every 5 minutes while the transmitter is worn.
We've done a previous video that covers all of the features of the Eversense 365 CGM in much more detail, and you can find it here.
The system is simply one of the most accurate on the market, particularly at low glucose values. It provides excellent accuracy with a MARD of 8.8%. Anything below 10% is considered excellent. Plus, this CGM has essentially no compression lows.
Now, the removable smart transmitter, which is waterproof, can be taken off and put back on just like this without wasting a CGM and without requiring any kind of sensor warm-up period. This flexible wear is so important for people living with diabetes like Steve and I, not David, with all the other do's and don'ts we have to deal with while living with this condition.
On-body vibratory alerts notify you of high or low glucose levels. You can actually feel it vibrating on your body. No need to check your phone or be interrupted or embarrassed by a loud alert. You'll see how our patient who snorkels takes advantage of this really unique feature.
The Eversense 365 CGM also has a skin-friendly design. Studies show that up to 30% of CGM users experience some kind of skin irritation, but the Eversense 365 has a gentle silicone-based adhesive that holds the transmitter in place and has been designed to minimize skin reactions to less than 1% and can be changed daily.
And the Eversense 365 is cleared as an integrated CGM system, meaning it can communicate with compatible insulin pumps and automated insulin delivery systems in the near future. All right, so let's get into our cases. Steve, you're up, buddy.
Okay, let's talk about case number 1. Ethan is a 52-year-old male with type 2 diabetes. He was diagnosed about 10 years ago. He is on multiple daily injections. He loves the water, so it's been easier for him to use that regimen. And in addition, he couldn't keep the transcutaneous sensors from falling off during or after being in the water, which was a huge hassle. Ethan was able to retire early and get a dream job working as a snorkeling instructor at a Club Med resort in the Caribbean. He conducts 2 group classes per day, one in the early morning around 8 a.m. and one in the late afternoon closer to 6 p.m. Ethan uses a long-acting basal insulin and a fast-acting insulin for boluses. He wears the Eversense E3 6-month CGM because it's inserted under the skin, and the overlying transmitter that sits on the skin above the sensor insertion site doesn't have to be removed when he teaches his snorkeling classes. Now here is Ethan's CGM download. Ethan's average glucose is 125 milligrams per deciliter. His estimated A1C, called GMI, is 6.3%. His glucose variability is 32% with a goal below 36%. His time in range is 81%. And his time below range is 7% with a goal of 4% or below. As you can see from the 24-hour glucose profile, Ethan would get low around 8 a.m. and then again around 6 p.m., which was when he was teaching his snorkeling classes. He still got his vibratory alerts while teaching because the smart transmitter will vibrate in 1 meter or 3 feet of water. This can be done for up to 30 minutes. I made the following recommendations to Ethan to help him avoid his lows while he's snorkeling. Reduce his basal dose by 5 to 10%. If meals are within 2 to 3 hours before diving, reduce his mealtime bolus by 20 to 30%. Consider trying inhaled human insulin pre-meals because it does get out of the system faster than the injected insulin, and this would reduce the delayed hypoglycemia while diving and at other times. Next, have an appropriate pre-exercise snack, such as protein, fat, carbs, and a good example would be peanut butter and crackers. Educate his coworkers on how to recognize and treat hypoglycemia with a glucagon pen. Living with diabetes shouldn't stop you from pursuing your passions. With all of the options we have today when it comes to CGMs, insulin types, and insulin administration devices, you can find a regimen that will work with your lifestyle, favorite sports, and activities. Ethan is doing great now and loving the Eversense E3 CGM. He is looking forward to his next insertion as it will be the new Eversense 365 CGM. No refills, no insurance hassles.
All right, my turn with case number 2. James is a 22-year-old male who has had needle phobia ever since he was a kid. This patient was diagnosed with type 1 diabetes at the age of 18 and had been struggling to monitor his blood sugars, both with finger sticking and CGM. He had briefly tried other transcutaneous CGM devices, but he didn't like that he had to insert a new one every 10 to 14 days and found that it would sometimes get knocked off because he's a very active rock climber. He started on the Eversense E3 CGM in April of 2023. At that time, his A1C was 8.7, and he was struggling to be consistent with his MDI regimen. At his next visit in October 2023, his A1C had improved to 7.4, and his time in range had improved to 67%. Surprisingly, his wear time of the Eversense was almost 100%, other than the few minutes needed to charge his transmitter. And he found that having continuous visibility into his glucose helped him overcome his resistance to taking insulin injections on a regular basis. He loved not having to deal with prescription hassles and the insurance company, and most importantly, by removing his mental barrier to wearing a CGM. This really empowered him to take control of his diabetes. And I'm happy to report that in March of 2024, his A1C had improved to 6.7%, and his time in range was up to 83%. We also worked on reducing his lows that occurred between 4 and 7 a.m.
All right, thank you, David. So I'm bringing myself in as the closer for case number 3. All right, so Jamie is a 51-year-old woman with type 1 diabetes, diagnosed in her mid-20s. She's an avid cyclist and was being treated with a hybrid closed-loop system using a transcutaneous sensor. Her control was pretty good, but she had several issues that led to her switching to the Eversense E3 CGM system. Why did she switch? Well, she disliked having to change out the sensor every 10 days with a warm-up time for each new sensor. It would often fall off when she was cycling due to the sweat, despite using cover-ups and other things. So she would run out of her sensors early, which led to huge fights with her insurance company to get a refill before the correct time. And another big hassle was that her sensor would lose communication with her pump, and that created control issues with the hybrid closed loop not being active all the time. And lastly, if that wasn't enough, the compression lows at night almost led to a divorce with all the alarms and whatnot going off. I'm just kidding, but it did cause disruption to her and her partner. So overall, Jamie felt that the Eversense E3 CGM was more reliable than her previous subcutaneous sensor, and that there were less hassles, especially at the airport when she traveled frequently for her job. With her active lifestyle, the new Eversense 365 CGM system will be a great fit. Despite not having automatic insulin delivery, her time in range is 79%, and her other metrics are at goal. Getting started with the Eversense 365 CGM system can be summed up in 3 easy steps. So first, don't wait. Prescribe it. Patients really do like this CGM. And 2, connect the Eversense inserter network to schedule the in-office procedure. And finally, continue with patient care. So to sum it up, it goes without saying that choosing the right CGM, it's a personal choice. And an implantable CGM sensor may not be the right fit for everyone. But the technological advancements that allow for a sensor to last for an entire year is pretty remarkable. By reducing the need for frequent sensor replacements, the Eversense 365 CGM system not only offers greater convenience, it also has an extended wear time, combined with exceptional accuracy and customizable features, which all could help to assist with better glycemic control and improve quality of life, which is ultimately what we're all striving for when it comes to our patients' diabetes care. So thanks for watching.